We have complete in-depth coverage of the coronavirus for you tonight. Our Leland Pinder tells us how universities are responding to students who are not vaccinated. But while health officials are preparing to roll out booster shots, they're also addressing concerns about the vaccine's effectiveness. Our Shannon Lilly joins us live with what they had to say tonight. Shannon?
Well, Bill, 8 months after you get your second dose, health leaders are now recommending that you get a third. But if that has you questioning whether you should get the shot altogether, health leaders have this to say.
No vaccine is 100% effective, and no vaccine lasts forever.
In a telebriefing Thursday, Virginia's vaccination coordinator, Dr. Danny Avula, says amid ongoing review of the COVID vaccine, there's 3 emerging trends. One, that the vaccine remains very effective against severe consequences of the virus, like hospitalization and death. But 2, that it is showing a decrease in effectiveness against the Delta variant and that it becomes less effective over time. But Dr. Avula says that doesn't come as a surprise.
This idea that the effectiveness of the vaccine starts to wane over time is inherent to vaccine science. We know that from lots of different types of vaccines. I mean, it's part of why we get a new flu vaccine every year.
And while some vaccines do produce longer-lasting immunity, Dr. Avula says the prevalence of the COVID virus in our communities plays into this as well.
In the face of an extremely prevalent virus that continues to change, I think it's reasonable that we adopt boosters to make sure that our protection stays strong.
VCU infectious disease epidemiologist Dr. Richard Wenzel echoes that sentiment.
Now that we know that the antibody levels go down after a period of time, we know that some of those people will not be as well protected. It makes sense to consider a booster.
He says a booster will prime the immune system to respond very quickly to something it's seen before to better protect you if exposed. But Dr. Wenzel says the most important thing is that you get vaccinated in the first place, putting into perspective the gravity of this pandemic, comparing the U.S. COVID death toll to that of the 1918 Spanish flu.
Here we are 100 years later with the same number when we have, rapid response teams, ICU protocols, expertise, drugs, and now vaccine.
And for those who may be skeptical about getting the vaccine now due to the inclusion of a booster dose.
And I think that's where we just have to keep going back to what is happening in real life, which is that we're seeing cases skyrocket, we're seeing hospitalizations increase, and the vast majority of that is happening in unvaccinated people.
Now, several agencies like the FDA still have to sign off on the plan, but if they do, that would mean booster shots would be available right here in Virginia by September 20th for our healthcare workers and nursing homes.